Okay, so small active speaker. Good morning, everybody. Welcome to our pajama party, our Monday morning pajama party. I'm glad to see you could all make it this morning. Again, reminder that we are recording this meeting, so just keep that in mind. And as usual, I want to start with thanking our sponsors who make it possible for us to continue with the task force. So I want to thank Care First Health Plan, Valley of the Sun United Way, Satellite Broadcasting and Communications Association, and Khajiit. So thank you all for participating. A couple of reminders, as I do every week, that if you want to know who's participating, you can check out our participant list, and you'll see those people who have taken the time to fill out the Google form. And if you haven't done so, please do so. I have to beg you every week, but please take 5 minutes to fill out that form. And that way we'll make sure we have your contact information, which is really important for us. Next meetings are, of course, the 16th, 23rd, and the 30th. Not any holidays that I'm aware of, is there? That I'm not aware of. Reminder that you can download the task force report. Oops. It's weird. The task force reports and the video from last week, if you missed that. And then moving on, let's see, what do I need to talk about? So Brendan, you're online, right? Brendan Blake?
Yes, I'm here.
So Brendan, if you want to take just a couple of minutes, Brendan is the Associate State Director for Advocacy for AARP, and we had a really excellent discussion about possibilities for doing some things with seniors. And so he's kind of new to this whole game. And so anyway, I'm going to turn it over to you, Brandon. You got 5 minutes to just tell people that you're looking for some partnerships.
Thanks, Steve. I don't know if I'll need the whole 5 minutes, but just wanted to thank Steve for spending the time last week to talk with me and one of our other staff members. We recently have started to engage in broadband work here in the state. It's sort of been a patchwork of other AARP state offices across the country. We don't necessarily always engage on this issue. It's more of a state-by-state basis, but we figured that given the amount of rural Arizona that there is here, that we should probably engage on this issue in ways that we can. We're hopeful to just be able to partner with all of you that sort of know what you're doing in this area and just figure out where we fit in best. A lot of the work that we do at the state level revolves around advocacy at the local, state, or federal levels. But most of the work that we're hoping to do is probably, there's going to be some that's going to revolve around advocacy, but hopefully we'll be able to do a little bit of adding to this network of connectivity as well. So some of the interests that we had, and Steve helped us sort of connect some of these dots as well, is certainly telehealth is something that AARP prioritizes. And so, I mean, as much as we would love to be able to say that, we can help to, grant fund some opportunities for, building infrastructure or some, cool, unique ways of getting broadband out to people, that's probably not where we're best suited. But if we can help make a connection or work on getting something passed that needs to get done, or even sponsoring something, something minor, we might be able to do that. But just sort of give you all an overview of where we're at and a level of expertise that we don't have at the moment. But we're happy to help in any way we can.
So Brendan's very interested in, of course, learning more about the whole digital literacy and digital access issues. And one of the things we talked about, which he kind of alluded to, is that whether AARP needs to necessarily get engaged in infrastructure obviously as an advocate would certainly be helpful, but certainly looking at the needs of seniors in terms of the use and adoption of technology, all the things that we've been talking a lot about related to particularly to students and families certainly also applies to seniors. And so what I was telling him is that we have lots of organizations here that might want to partner with him. And he did allude that they have some money for some possible grants. So if any of you are interested, I'm actually thinking that maybe a special interest group for seniors might be a good thing for us to take on. So anyway, you're more than welcome to contact him. I've realized that I didn't put his contact information on here. I guess I didn't. I thought I did somewhere. But anyway, I will put that up here. And again, you'll also find his contact information in the minutes of the meetings. So any quick questions for Brandon, comments?
Hey, Steve, this is Jeff. Number one, just because I had a birthday over the weekend is no reason to make me a head of the senior committee. We're not going to have that. But I do think it's great that AARP is involved. I think that's a really interesting organization, particularly with our outreach on the EBB program. There's a lot more money coming to that program that's going to be extended. I know Janet Major and others have worked really hard. I mean, I could get on the list, probably have half a dozen organizations on this call that have been involved. And that is just strictly outreach and getting to the folks and helping them understand the program. So if there's any way that we could get them involved, I think that would be a great start.
Yeah. Well, again, connecting him with, and one of the things I specifically had conversation with him about, and just by coincidence, that Janet is presenting this morning, is telehealth and how important that is for seniors. So that certainly is one avenue for partnerships. But as you said, we have a number of organizations that could probably partner with him.
Yeah, if I may just add, Brandon, our organization, ELAC, has for years been putting young people together virtually with seniors in senior home facilities. We attempted a couple of years ago locally here in Tucson to engage your management in encouraging some of your seniors to join our youth in this intergenerational exchange. I hope we can take some steps to make this happen.
Great. So while Mike was speaking, I'm sorry, yes, go ahead. Who's that?
Hi, it's Erin Cardorton. I just wanted to jump in real quickly and just say we are working on a digital literacy program inclusive of, from a lifespan perspective, so inclusive of elderly folks. So I would love to talk to Brandon separate and distinct or as part of this.
So you want to tell people who you are?
Sure. My apologies. I'm on the phone because I have somebody here painting my house. So my apologies if it's loud here. I'm Erin Cardorton. I'm the head of social impact at ASU, and I'm part of Lev's team and working with Dom on the Lighting Up the Future campaign. And I'm coming in to help to lead the digital literacy aspect.
Great. So we don't have much more time today because we need to move on. But again, all the contact information. So Brendan's contact information will be there. And Brendan, you can certainly peruse that list of people who attended today and our other list and see if there's others that might be of interest. And I'd certainly be glad to follow up with you also.
Thank you. I just want to make sure, have I filled out the Google form? I thought I did. If I haven't, I'll go ahead and do so now.
I don't know, but I'll have to check for you.
Okay.
I think you did.
Okay.
So,
right,
so I apologize. We have a couple of new people who were on the call today. Mike Rohrbach, you want to introduce yourself quickly?
Yes, Mike Rohrbach, the founder of the digital literacy work that we do. It is an intergenerational program in which we empower young people to become the instructors as digital natives of adults, working adults, and seniors. And the primary purpose is to reduce the isolation on both parts, but also to allow young people to do a natural interaction with adults using a talent that most of them have.
Okay, great. Anybody else that's new to us today?
Yes, good morning, Steve. This is Heather Floyd. Oh, I'm sorry, I'm coming through on my cell, but I'm also on video. Heather Floyd with Valley Telecom. We're a rural internet provider, basically copies Graham and Greenlee counties, limited availability in Santa Cruz, but we're looking for ways that we can expand our reach and improve our technology. We have fiber, copper, and wireless, and we're looking to basically replace our copper with fiber everywhere where our footprint is. Glad
Great.
to be on the call. Thank you very much.
Good, welcome. And anybody else that's new to us today?
Good morning. This is Lindsay Dietz. I work with the Health Center Control Network, which is a grant from HRSA. This is our 5th year, and we have a whole component focused on telehealth from Collaborative Venture Network.
Okay. Anybody else? Going once, going twice? If not, let's welcome to our new participants, and let's get on with the meeting. So Jeff, you want to start? And I will ask that the folks who are doing updates to please be as succinct as possible, because we tend to get a little long and then we run out of time. So please keep it as succinct as possible, but obviously cover the most important things.
Sure. This will be super short today, Steve. We're continuing to work with KPMG, looking for an early fall end date, at which point the 2018 plan will be updated. There'll be some more information on that as we get closer.
Jeff, will you explain that a little bit, what they're doing?
So we have a 2018, there's a broadband plan. It's a state plan that was put together by a lot of really hardworking people. It's more, we wanted to make it more tactical, particularly around our highways and access to our highways and connecting what we call the population centers, which are the communities throughout Arizona back to Phoenix, among other things. And they have met with, I believe, 20 different groups to talk about, 20 different people, 15 different groups, everyone from groups like LEV and the folks at ASU, to various carriers, to communities, just to really understand the scope of what people are seeing out there and help us narrow down that process. So we're going to have an update. We're certainly not going to scrap the plan. It was well done, but this will take it to the next level and make it a lot more tactical and lay a blueprint for the next 5 years in terms of how we're going to spend state money on these functions. As you can tell, there's a lot of money coming both from the federal government and from the state budget. We want to make sure that we have a plan in place that everyone understands and has the opportunity to participate. Also, last week, I had a chance to go to the Local First Rural Policy Forum in Sororita. For those of you who are not familiar with Local First, very impressive organization, working with local communities to help them, make them more marketable and attractive and increase opportunities for their citizens. If we don't have anybody on Local First from this group, Steve, we should. Very impressed with a lot of the work they're doing, and they're going to be a key partner of ours moving forward in terms of providing grant writers to communities and that sort of thing. A lot more to come on that. Lastly, I'm going to be heading down to Eloy, Arizona later this week for an announcement with the USDA. I think we're starting to see some real results here in Arizona. This is going to be an exciting result for Arizona and for Central Arizona as we continue to build out our infrastructure. So stay tuned on that, and I'll go ahead and keep it very, very short today. Thanks.
Thanks, Jeff. Any questions for Jeff?
Yeah, Jeff, this is Kirk. I'm going to ask you to talk some more. So this morning on CNBC, they actually said the words rural broadband as it related to the infrastructure package right now that's on the Hill. Can you, and I'm not sure who else is our policy guru on this group, but can you speak to how close that is to passing and what our impact is?
So I can't speak specific to DC. I have been briefed by some folks in our delegation in regards to what they expect to be in there. But again, this is in the Senate. It still has to go to the House. It still has to be reconciled. So I've given up on counting on anything quickly from DC a long time ago. And that's just more of a mental health issue for me, I think, just because I tended to get a little upset about the pace that things go. That being said, I will say this, that our Senator Sinema, has led on this issue and has done a fantastic job of making sure that rural broadband is in fact included in this and pushing forward. And I can't say enough about the job that her office is doing right now to make this thing happen.
And if I may, Mark Goldstein. So I did find the language had leaked out in various ways. A law firm, Keller and Heckman, had a detailed blog analyzing the elements of the portion of it that's known as the Broadband Equity Access and Deployment BEAD program. There is 42 million in there for state block grant, 100 million per entity, state or territory, plus a share of the rest based on a measure of need in that state. But it used to, the earlier models were based on population, but it is based on need. And so in Arizona, it's hard to calculate, but of that 42.5 billion, it could well be something like 800 million here. I believe there's another 15 million to recapitalize and expand the USDA Reconnect program. And then there's about 5 billion or so in digital equity. But in any case, I posted a detailed blog link that will take you through that. One critique I'm seeing from Shelby is interesting, that the way community anchor institutions are treated is at a lower priority tier and could well be muscled off the board by other projects in the block grant program, the way that they are an expansive definition of what a CAI is beyond schools, libraries, and healthcare, and other factors. And so these things will change before it leaves the Senate and before it is agreed to in negotiations with the House, but very good detail in that blog post about what is actually in there.
And Mark, great analysis. Keller and Heckman provides a great product. And having read that, I just want to caution everyone that to the last, I guess it was the first stimulus program that was signed in January, up until about a week and a half before the thing was done, we were going to get block grants to the states, and we were all dancing around happy that was going to happen, and that all got changed at the last minute. So use an old sports saying, it ain't over till it's over. So all right. Good news, all positive, but let's wait for the final bill before we spend the money. But this is really good stuff.
Yeah. Good point. Okay, let's move on. Mala, are you online today?
Yes, I am. Yes, thank you.
And please introduce yourself, Mala.
Yes, this is Mala Muralidharan. I'm the state E-rate coordinator for public libraries. I work with the libraries to get E-rate dollars to all of our public libraries. And I also work on other committees that help shape this. I was involved with Shelby last week. We discussed the infrastructure bill and the Infrastructure Investment and Job Act, as it is called. And thank you for that very good summary, Mark, and for the links that you posted on the chat. We are excited, but cautiously so, because the anchor institutions, although they've expanded the definition of it to go beyond libraries and schools to include public housing authorities, healthcare providers, and community support organizations, anchor institutions have been relegated to third priority. The first priority goes to the unserved, the second to the underserved households, before any money can be allocated to or spent on anchor institutions. The fallacy and the anomaly in this whole thing is that the anchor institutions have been for years getting high broadband capacities because of E-rate dollars and other money that has been flowing into the country, into the state. And they are key to anything being, they are the key middle mile before it gets connected to the unserved and underserved households. So let's see how the rules play out finally, but I'm not losing hope that anchor institutions are not going to be considered. They still have it on the bill that the anchor institutions need gigabit connectivity. So somehow it's going to happen. The thing that concerns me more is that the deployment is based on maps, the FCC maps, which are pretty old and not accurate, and they rely heavily on industry provided data, which is in some cases notorious for overstating coverage. So we're working still on, I don't think it will be ready though, the new maps that show accurately or as close to accuracy as possible, the correct infrastructure mapping as it exists. So that's the concern. And the second concern that we're having is not connected to this, but it's going to be eventually connected to everything that receives federal funding, is that the Universal Service Fund that has the rules to collect this money is still outdated. There has been no discussion on how the collection process for the funding is going to improve. So we're waiting for all those actors to take effect, but really super delighted that there's yet another broadband bill that is being considered, and this is a priority before the next pandemic or whatever hits us. I'll take questions on this if anyone has any questions, but the Shelby link that Mark has put up is really good, and as well as the blog that is in your chat is also very good to cover all the points that you need. So, and just one other thing, very, very briefly, the EBB has enrolled 92,743 households in Arizona. So this is great. We're moving along. We're moving along slower than we were in the first couple of weeks, but we're still moving. So hopefully we will hit the 100,000 mark this week with the signups. But sadly, the ECF is not doing as good because there has been a lot of issues with libraries having to sign up and maintain data and having got the strings attached to it to get as well as distribute tablets and laptops and connectivity. So any questions? Otherwise, back to you, Steve.
Holly, you're online, I think. Do you want to add anything?
No, I don't have anything to add. Thank you, Steve.
Okay. And in the next week or two, we're going to get an update from Nicole on what's happening with the project. They've done a great job. And so we'll be get an update from Connect Arizona also. Cindy, I know you're online and I don't only have a couple of minutes, but I know you wanted to do a quick update.
Yes, Cindy Hogan, and I just posted the EBB tracker in the chat, which shows what Mala just said about the status of Arizona in the EBB process. We're 14th in the country, and actually Pima County has signed up 21,233 households, which is more than 14 whole states have done. That's in the 857 zip code. I wanted to talk also about it. The program is working fairly well. I will point out at the bottom of the item that I just posted, it talks about that there's out of 32 3.2 billion, there's still $2.9 billion in funding left for this program. So I'm not sure exactly how that's calculated, whether it includes the full participation of yeah, I'm not sure where that number comes from, but there's still a lot of money left in that. I'm actually working on a sign-up event with the City of Tucson Housing and Community Development. We're trying to plan something for the fall to just try and keep the momentum going. I'm also taking part in a National Digital Inclusion Alliance work group that's talking about people's live experience, signing people up and giving feedback to the FCC. And then I also wanted to just make mention that there is an annual Digital Inclusion Week that happens in October this year, from the October 4th to the 8th. And I will put that is spearheaded by the National Digital Inclusion Alliance. And I'm going to put a link to that webpage in the chat so that everyone can keep that on their radar. That's all I have. Thanks.
Great. Thank you, Cindy. And Cindy, you've got a little change personally. Do you want to comment on that at all?
Yes, I'm an AmeriCorps member. I've been working within the United Way for the past year, and that position or that term has ended. And so I am probably going to be going to work for the Housing and Community Development Department at the City of Tucson and continuing my work looking into digital equity and digital literacy.
Awesome. I hope that pans out for you, Cindy.
Thank you.
We definitely want to keep you around. Okay, moving on, Janet. Well, Janet Major, you want to do just a quickie, and then you're going to do a presentation in a little while.
I have all my notes in my presentation, so I'll wait. Thanks.
Okay, sounds good. Sophia?
Sure. Hello, everybody. This is Sophia Mayberry. I'm the project manager on the executive team at the Arizona Department of Education. Steve, feel free to stop me if I've already shared this update, but I don't think I have. Recently, the department announced that we purchased Discovery Education subscriptions for every teacher and student in Arizona. We're currently working at the school district level to get teachers and different school districts onboarded. I will put the link for the Arizona, our Arizona kind of portal where we're getting people signed up in the chat. But really, we're not mandating that you use this or anything, but it's a really great resource for some extra curriculum materials for teachers. And it has some really great videos and virtual field trips and resources that students can use to enhance their learning. And we're really excited. And we hope to get as many schools as are interested signed up for this free service that we've bought for everyone using our federal funding dollars. That is my only update, but I'm happy to answer questions.
Okay. Mylan, are you online? I don't think so.
I'm sorry, that's a good reminder. Mylan sent me an update for Final Mile. Let me share that as well. I'm just pulling it up so I get it correct. So for Final Mile, they've completed the RFP process. And so they've gotten them all in. They are in the process of reviewing them and doing the final interviews. Hopefully, formal announcements will be made soon.
Okay. Just a reminder. I'm sorry, go ahead.
Go ahead.
I was going to ask real quick, is Mylan off on PTO in an undisclosed location this week, or is he available? Because there's some stuff I need to get a hold of him about.
He internally does not appear to be off today. We have like an internal chat system. It does not say that he is out of the office today, so I don't see any reason why, at the very least today, he wouldn't answer your message or call.
Yeah, I think he has 2 back-to-back calls right now. I'll reach out to him. Thank you.
Okay. So just FYI, that Final Mile that Sophia was referring to is a project being led by the Arizona Rural Schools Association. They're doing some great stuff. And the Arizona Department of Education put in, was it $1.5 million, Sophia, to help support that project?
Yes, that is correct. That's why we're hoping the final announcements will kind of be shared with us today or I'm sorry, this week. And then we're hoping we'll be able to announce more soon on that project.
Great. Okay, moving on. Leah, are you online? Didn't see you. Okay, not here. Derek, I think you're online, aren't you? Derek Masseth, are you online? Guess not. He's busy. Got lots of great projects going on. And Wes Brownfield, I don't think you're online either, are you? Okay. Well, with that, any questions for anybody before we move on? Okay. If not, I would like to introduce Janet Major, who many of you already know. Janet has been a tireless advocate for telemedicine in Arizona, and we're pleased to have her. I'm going to stop sharing and let you share your presentation, Janet. But Janet has been a tireless advocate for telemedicine and broadband in the state for, I don't know how many, 30 years, Janet, 20 years, 30 years, something like that.
Yeah. Long time.
Yeah. And so, you know, it occurred to me that I know for a while there, Janet had conflicting Monday morning meetings. So we really hadn't had a presentation from her about what they're doing. So with that, I'm going to turn it over to Janet and let her tell us about what's happening with the telemedicine program, which is one of the top, Arizona's is one of the top telemedicine programs in the country. Janet, it's all yours.
Thank you so much, Steve. I always say I have the best job on the team, and I'm so excited about presenting here today because you are my people. It's great to talk about things from a telecommunications perspective and a 25 years worth of experience. And I don't want to spend too much time on the past, but I really do want to be sure to share with you some of the history with this group. There are some folks in this group that I've served with on the board for ATIC for 25 years as well, but the Arizona Telemedicine Program is 25 years old. And I'm very fortunate. My BS degree is in telecommunications. I'm not a video engineer. I'm a behind the scenes lights, camera, action person who makes telehealth happen and teach people how to use the technology. How cool is that, right? I want to begin by letting you know that in 1996, we actually came to be because of some very smart legislators who approached the College of Medicine and said, we just saw a presentation at the Western Governors Association meeting, and we need this in Arizona. Now, this is very forward thinking. And then Representative Bob Burns, who many of you know, and the chair of the Joint Legislative Budget Committee, John Lee, started an annual allocation to the College of Medicine so we could build our program. And since then, we've written just about every grant that there is, and we've also annually received money from our state legislature for the College of Medicine to produce this program. Now, our founder, Dr. Ron Weinstein, credits Bob Burns as our co-founder. And on the left, you see Rick McNeely. And this is what introduced me to Steve. 30 years ago, when I was video conference coordinator for the Masters in Public Health program, we had a group in Tucson called the Tucson Link, which was Steve's connection for us, much like ATIC. We were the ATIC of Southern Arizona. And that's what really helped foster advocacy for broadband for me, as well as the fact that, of course, without the telecommunications connectivity, this doesn't happen. So the thing that I really believe our legislators also believe, not just access to healthcare, is the fact that it's good resource management to do telemedicine and telehealth. To do as much as we can at a distance is going to be a big part of how we can deliver healthcare efficiently. And that's the bottom line, right? It's hard to think about healthcare as a business, but it is a business. And we do, as a state, benefit when people stay in their hometown for healthcare. We need the sheep herders to stay where they live. We need the copper miners to be where the copper mines are. And the fact is, people often don't want to travel for health. The other thing, and I hate to start with a disclaimer, but the fact is, telehealth and telemedicine are tools. These are things that you can do that make things, I swear, the same as being there, the next best thing to being there, cut your travel in half, whatever the case might be. This is our future in being able to really do things that support our economy in a good way. And this is where we are now. And I'm not going to say silver lining, but I will say that we've known this, you, my people. If you've got bandwidth and you've got technology, you have access to healthcare. And people now realize this. People now realize we can provide access to healthcare to the people who need it most. And we also realize, of course, that everybody needs bandwidth. Everybody needs telecommunications connectivity, whether it's for school, for healthcare, for your work, for your profession, for training. We need this. And oftentimes there are socioeconomic issues. There are a lot of reasons why people don't have access, and we all know them. So when we started, this was like a T1 line to everywhere and temporary circuits from point A to point B. And I did amazing things like with a single phone line video phone. But our charge from our state legislators was to build a telemedicine network that would provide the backbone connectivity to these charter sites. And there were Indian Health Service sites. There was a prison site, very smart. We ended up in 9 prisons. That's one of my claims to fame. I've been in 9 prisons for work, installing equipment. And now the prison system's booming. You know, they've built out their own network. They just purchased some really nice Amwell carts. You know, the carts aren't quite dead yet. There's amazing things people are doing out there. Some sites were more successful than others, and I really want to share with you some of the lessons learned. Now, as the network grew, we started providing network redundancy for places like IHS. It took us a year to get a T1 line to Ganado. That was one of our first T1 lines. We got a T1 line to Nogales, was our first site that we built. And then, of course, as we grew, other people's networks grew. And of course, you can't talk about networks without a beautiful cloud map. And we became a network of networks. So that cloud off to the right, IHS, 12 sites, that's more than 12 sites now. But there are a lot of different networks now that provide telehealth services. And I'd like to share with you some of their stories too. Well, we can be just about anywhere, anytime. And fortunately for me, what I love about the word telehealth is, to me, that speaks of the fact that we're also doing education at a distance. And so much of medicine is part of the treatment is education, right? So we've demonstrated for a long time things that should be billable, and now they are, which is amazing. It's a great place to be. And my job in the team has been to be the investigative reporter with regards to technology. There's my first digital camera, 1 megapixel. And the ATA was a corner of a conference called Telecon. And this was the USDLA conference. So I was also active for many years in distance learning. I could spend a lot of time talking about that too. But the technology is great because it's now grown to where technology has a purpose, and it's not just really cool stuff, but there is a lot of really cool stuff out there. So to try and find the right camera for the job is what I get to do, to try and write the technical protocols to complement the clinical protocols is a critical part of my job, because the fact is this stuff has to work every time. And that's a matter of training and mock patients and all kinds of activities. The other thing that's a big challenge now are stethoscopes. So again, another topic I could talk about all day, but you really honestly have to think about compatibility issues. And if you look at that stethoscope, or that disc on the bottom right, got an open mic there. Can I help you? The stethoscope on the bottom right actually immediately converts heart sounds to a Windows media file. So, you know, cardiologists now can log on to a website and you can send them your heart sounds. Or if you want to listen to heart sounds live, then you may play just to their speakers on their desktop. It's a whole new world in stethoscopes. So we've planted a lot of seeds along the way. Many have bloomed. And the thing that I do want to share with you is as many of those stories as I can. And the fact is that nothing's really bad or ugly, because we learn something every time. And some of the things that we learned, you might think sound very simple, but again, it's all about efficiency. And there are really interesting aspects of building out telehealth and telemedicine programs that I want to share with you. And now, as a telehealth resource center, we get paid to do this. And we actually support 5 Western states. And it's amazing to me how much we've learned from other people. So what I have always been able to contribute is the lights, camera, action part. So this was our first room, and it was in Tuba City. And you can imagine we would all look pretty sick in a pumpkin orange room. Our first actual installation and what we developed as a template was to Nogales, Arizona. That was the first grant we wrote. Had to do a little rewriting because it was not defined as rural. So we wrote a different grant, and we were able to come up and have a place that was only 60 miles away that we could support, and then came up with this template. And it meant, you know, finding enough room for this big refrigerator unit. Tuba City was amazing. As soon as they were installed, we upgraded their equipment, and we actually were able to do things out to the chapter houses. They dedicated a room in their internal medicine clinic. And this is the same thing that happened in Nogales and in the prison sites. A room is dedicated, and we paint the wall of light, flat latex paint. light blue, and install the same peripherals and the same equipment, which made it very easy to maintain. The other thing that made it good in terms of economics and building out, same thing with our team being a hand-picked team. Every site that we would work with had to identify a telemedicine site coordinator, and we would pay 0.25 of their FTE. There has to be an expert and there has to be a champion, and people need to be compensated for their money and for their time. And I think that that was really an important part of how we built our program. And that's how I see current programs being built. But now, of course, people can hire a full-time telemedicine coordinator and have plenty of work for them. So meanwhile, same time, we were doing vitals at the chapter houses. And so here's the medical director of Tuba City had an undergraduate degree in film, and he got it. And so we were able to do amazing things with Tuba City, and we were able to go out to the chapter houses and do vitals back to the clinic in Tuba. And here we're celebrating in the chapter house and having a blessing way ceremony because they got a Polycom unit and more bandwidth, which was a whole lot less painful than, of course, trying to do things with a very primitive video phone. Now, you know, later as Tuba City grew, they were able to build out services like 1 hour turnarounds on a mammogram. So if someone drove all the way into Tuba City for a mammogram, you could get your results and get some follow-up and make arrangements and get some education that day, which is really impressive. And there's no reason why we couldn't be doing a whole lot more of that. So this is the template. Back in the day, you know, we were still doing X-ray scanners. This is in Douglas, Arizona. We were able to design the room and make everything fit. Same thing in the prisons, so that we were able to have a way in which we could basically be building small TV studios that were dedicated for telehealth in specific sites, and they all connected back to Tucson. Now, we still have this room as a training facility because what we do, if we really want to prepare people and train them, they need to really do participate as a patient and as a provider and as a specialist. And some of the things that we've been able to do throughout the years, this was one of our first pilots, and it speaks of the power of telemedicine. These are cardiologists with a Native American cardiology program, and they're reviewing an EKG, which was sent from Tuba City. So, you know, these cardiologists could be in Flagstaff, Phoenix Indian Medical Center, or Tucson, and their patients could be in Flagstaff or Tuba City, and they could, anybody, a technician could record their study, and then the cardiologist could review it wherever they were. And this is absolutely the way things are now, and very important. Now, one thing I'd also like to speak of is the fact that currently we can now get really great stuff off the shelf. So in cells, the difficulty, what took 10 years was to get the contract signed. And the behavioral health contract is with Indian Health Service in Albuquerque. We really tried to get the contract signed in Tucson. It just didn't work out that way. And it did literally take 10 years. Well, the technology took like a day, right? Because it's an off-the-shelf Ergotron cart, off-the-shelf computer, Jabra microphone, Logitech camera. One of the difficulties in this room was there's a door or a window on every wall. So they have this beautiful background. They slide in front of the door, and the telepsychiatrist gets all the details and can zoom right in on the face. And they've got a beautiful background. This is really very important. And these are things we don't think about. And we all, you know, you're video conferencing in your home right now. You know, you don't think about the pictures on the walls behind you, these kinds of things. But these are very important things that I get to teach people. So we have a medical director now, and we do not actually provide medical services other than this one clinic. And our medical director has been an infectious disease expert for many, many years, and he has several patients that he's had for 20 years, and we're currently negotiating with Banner to allow him to continue this service. He has a very efficient way in which he works in our physician's review, and he uses a video engineer that makes all his connections, and now, of course, it's all done through Zoom, but he still has an engineer constantly monitoring his clinic. He has a pharmacist with him. He has a social worker, and he has his office manager. So that right there is like 4 network connections, but it's still very efficient because, you know, and we still fax. I got to tell you, we still fax a lot in telemedicine. And there are ways in which, you know, I think of it in my background in technical theater, it's like pre-production, right? There's a lot that goes into making a clinic happen. And a lot of what he does is grant driven, which helps him be so extravagant in terms of his staffing. But the fact is now so many of these things are absolutely billable. And fortunately for us, you know, and other folks, we have the staffing now that we can do that. So I want to talk a little bit about telegenetics and how we're preparing the healthcare workforce of the future while developing new applications. So I got to work with this amazing group of genetic counselors from the health department in Hawaii and the Western States Genetics Collaborative. And we developed this incredible hybrid model for training certified genetic counselors how to do telegenetics. And this same type of model is being integrated into medical schools and nursing schools. So we absolutely can do so much content online very efficiently, a hybrid course. And then we bring everybody together in person to do the hands-on and simulations. We can't just train and prepare the healthcare workforce of the future with simulations, but being able to do patient scenarios is very important. And we have paid professional patients at the College of Medicine. But for the genetic counselors, we put together a little fake baby doll, and we asked the genetic counselors to be that mom holding a newborn with Down syndrome. And then take your turn being the genetic counselor who's drawing out that family pedigree. And then the third part of the rotation, of course, is being the genetic counselor. So by rotating our students through those three settings, they can experience what it's like. They know what the communication is. And the fact is, it really is a great experience. And the thing that these ladies really stressed out about a lot was the eye contact. And the fact is, you don't make eye contact 100% of the time. And if you are, you're kind of creepy anyway. And all of our professionals, all of our telehealth providers struggle with this. You don't have to be staring into the camera the whole time. Now, you want to tell your patient what you're doing, and you want to go back and forth, but it's absolutely a compromise, and you need to balance it out, because in the end, the focus is on the patient. You might be communicating using a camera, you might be using software, you might be using other things, but at some point, the focus is on the patient, right? So it's a great way to really actually have the opportunity to teach clinical professionals how do you actually integrate an interpreter and do the introductions by video and provide those services. So there are a lot of great things happening throughout Arizona. Flagstaff Medical Center in Northern Arizona has this amazing backpack to go type program where they've put together a backpack with some really pretty simple technology. It's a phone, it's a partnership, yay, community public private partnership. The telecom provider provides the phone. The hospital put together the backpack that has a solar battery and a blood pressure cuff and a digital scale. And this goes home with cardiology patients who are being discharged, so that every day they take their weight and they take their blood pressure, and the phone automatically connects it back to the call center. It's just the most elegant example of how efficient this can be. The backpack's under $300, and the hospital can prevent readmissions, and it's just a win-win for everybody. And there's some great videos that tell the story, so the links are here for you. And it's a beautiful, beautiful video about about the whole Four Corners area. Now, meanwhile, North Country Healthcare, the community healthcare center there in Northern Arizona, has about a dozen satellite sites, Peach Springs, some really remote places, and they're providing primary care using video conferencing and telehealth clinics, as well as accessing their resources in Flagstaff, Arizona, their hub site. So that everybody has stethoscopes. If you want to prevent a pre and post-surgery follow-up, you have to have stethoscopes. So of course, they're doing heart sounds to their hub. I'm not sure what other services, but they're absolutely solid doing primary care. And we also have colleagues from the Northern Arizona, what was formerly the Northern Arizona Behavioral Health Network. They were actually funded by our state legislature the same year as us and continue to be funded, although their name has changed. But behavioral health has changed. It's now one part of a patient's total treatment. It's all integrated care. And Dr. Sarah Gibson, who's done thousands and thousands of adolescent telepsychiatry cases to Winslow, Arizona, from Flagstaff, Arizona. Well, she serves all of Apache Junction, I guess. But she shared this interesting slide, which I hadn't thought, you always see comparisons in terms of geography, but Northern Arizona is larger than New York and New Jersey combined. Pretty cool, huh? And there's a lot happening up there, as well as in Southern Arizona. El Rio and other community health centers, business is booming and satellite sites are being built. Well, you can't talk about telemedicine without talking about robots, and they're nice little robots for education. This cute little robot was under $3,000, and the best applications that I've seen for it are bone marrow transplant patients. I used to send home a video phone in a Federal Express box with patients and test a video phone so that if a child was secluded for a month, they could have dinner with their parents if this video phone was hooked up in the dining room, right? Well, now this little robot at Boston Children's Hospital has this little robot, and they can send it home or they can have it be in the classroom. So the kid can be like going to school. Very, very interesting applications, but robots are funny because they're very expensive. And they're saving lives, big sophisticated robots like this. This is through the Mayo Stroke Program. This is saving lives all over Arizona. I've also seen this same type of robot in Juneau connected to Anchorage. It was an ICU robot. Now they're really great, but they're, of course, they're very expensive. The good news is you can budget what your annual contract is going to be for maintenance and all of that, and it's an incredible investment. But one thing that the nice gentleman that you see in the face of the robot is Dr. Brett Demarshik, who is a teleneurologist and helped develop the Mayo Stroke Program. And he's doing really interesting research because he's investigating, do you really need that big fancy robot? How much can you do if you were to put together a different system, your own type of way of doing things, which I think is really smart. He's a smart Canadian. So stethoscopes we already talked about. Global Med, this is interesting. The big carts are still around, and again, you can budget your maintenance. You've got somebody to call if something's not working. Global Med is a Scottsdale-based company, and they're all over the world and all the VAs. And the last American Telemedicine Association conference that was in person in 2019, they started also packaging their robots with teledentistry tools. Teledentistry is booming. It's a great area of interest. It's a great application to do like triage and get a lot of things done at a distance. But it again has to be considered as part of a business plan. Because one thing that I've seen in Indian Health Service sites that are not accessible to people, they might have a whole wing for dentistry, but people don't come. You know, we have to be able to deliver healthcare where people need it and want it, including teledentistry. And then the other exciting thing these days is you can now get a very nice ENT scope for $350. You know, this is like a school nurse's dream come true. My first ENT scope cost $12,000, and now I've got an HD one that costs more. Well, these are really very nice for $350. So, you know, smaller, better, faster, cheaper, just like digital cameras, everything, the price is going down. So when you think about the future, what does everyone want to do? They want to be on an iPad or a tablet. And there's so much we can do. We have a really smart nurse, Dr. Kim Shea, smart doctor nurse. She has been, her specialty has always been care for the elderly, and she's helping put together in a statewide task force a scale for palliative care and hospice care, and she is providing care to patients using, and this is grant driven, but the fact is now a lot of this is potentially billable. We do the same thing for ostomy patients. Patients who are discharged and want to be part of a support group, it's a study. If they don't have a tablet or an iPad or a phone to participate, then we can provide them one, but they can't participate unless they test back to our network engineer's desk. People are very proud of their old technology, and I would much rather provide it, actually. This is another great backpack to go model that's been taking place in Southern Arizona. We have a pediatric pulmonologist that was driving all over town, listening to heart sound screening for asthma. So we worked with his nurses and put together a backpack with an off-the-shelf laptop. They bring their own hotspot, a stethoscope, again, just echo cancellation microphone, Logitech camera. So that means the nurses can go with this backpack. They can go to the nurse's office and they don't need any top secret passwords for network. They've got their own network. All they need is the room, and the nurse brings them the students. So it's very efficient, and everybody loves it. And you can see he's got an avatar on the screen. He meets sometimes with the same kids because once he does screening, he can do follow-up. And now this is absolutely something that would be billable. So the most recent backpack to go model that I saw was at our telemedicine special interest group. And you can see here our chair, Dr. John, I always call him John, so I never, John Savage, Dr. John Savage, he's a DO. He works in suburbia Denver, lives in Denver, works in Denver. Here it's kind of hard to see, but in the center of the screen, he came up with a backpack that has telescoping legs. So he can go out where the homeless people are, underneath the freeways, in the parks, wherever. His team can go out there, extend that backpack leg, and they've basically got a small table and they're hands-free to do vitals. It's just a really great design. Really like that. If you haven't heard of ECHO, this is an interesting program because this is what is the trend in what really we've been doing for a very long time. Physicians can get together and talk about a specific area of specialty And then they can actually, in a non-identified way, discuss their own patients if they submit their lab values and information in advance. So the person who started this, and please visit their website if you want more information, he's from India, and now this is all over the world. It offers CME for the doctors, and it absolutely should be billable. They are discussing the course of treatment for the patient, but the patient is not in the room, so it's not billable. But this is going to change because the data is fantastic. So we do an echo telerheumatology. So our rural physicians might not know a lot about rheumatology, and there's 2 rheumatologists for the whole state of Arizona. So here is a group of primary care physicians in Bisbee. Here's the Hollywood Squares version. So Nogales, several sites are participating, and they can, if they submit their patients in advance, it's like ask a rheumatologist. And these are really great conversations, and these are absolutely improving people's health and giving people access to care. And this is literally all over the world. So the future for electronic medical records as well is to be integrating video conferencing within the electronic medical records. So you can go and you can download an Epic plugin for Zoom, and other providers are doing this as well, which is pretty interesting when you think about it. This means me as a patient could go to the library or go to a private place, connect to my patient portal, and video conference with my provider while we're both looking at my electronic medical record. And that's, you know, all it takes is a computer and an internet connection for a lot of this stuff now, right? And the other thing that's very interesting and futuristic to contemplate is there are now hospitals that have no patients in them. These are bays of operations centers. There's a big one in Mesa where Banner has a remote operations center. They call it their ROC, and they're monitoring patients all over the United States. So this is really part of the future as well. And in Northern Arizona, if you haven't heard of this, it hasn't been very public. It's very much the ground stage in the 5 to 10 year plan. But Northern Arizona Healthcare, which is Flagstaff Medical Centers, consume much of the top of the hill on San Francisco up in Flagstaff, if you haven't been there. Well, they also have acquired, their foundation has acquired 162 acres and location, right? It's where I-17 and I-40 converge. It's not very far from Fort Tuthill, if you've ever been there for the powwow or rodeo or anything. But anyway, they're building what will be an incredible complex in which they will be offering a lot of virtual care services. And they go back to that map of half of Northern Arizona, and that's really their ambition. They are a major healthcare provider for Northern Arizona. So I do want to spend the next, you're just gonna have to stop me if I run out of time. I do have, I will give you my slides without the people's pictures in them, so you'll have all the information, but I absolutely have to talk about my passion and what I hope that we can do, and what I definitely plan to do in the near future. All the stars are lining up to go back to working in diabetes. So I think about telemedicine, telehealth, and diabetes, and that's one of the best matches that there is. And we, for 5 years, I think we started out with a 3-year HRSA grant that was extended for 2 years. And then we got Arizona Department of Health Service for a couple of years, and then the money stopped flowing. So of course the grant stopped, but we found out and demonstrated and did amazing things. And we did amazing things with people here. So I really have to tell you about this project because it did involve telecommunications connectivity, and it was a Wi-Fi demonstration back when Wi-Fi was brand new. This was like before the internet stuff, I swear. Wi-Fi, a demonstration that Wi-Fi could be consistently provided between this corridor in Southern Arizona. Well, I had been doing this diabetes project with Tuba City, Nogales, Arizona, and St. Elizabeth's of Hungary Clinic, and we really wanted to get to a model. The mobile health program that you see would go to a model to deliver healthcare. Well, we were using a single phone line. That's all we had. Well, this Wi-Fi corridor to demonstrate first responders, somebody had the great idea, gosh, let's see if we can bring telemedicine into this. And this was a project that was a collaborative effort with ATIC. And I think YBOD was the provider. Mark, you're a much better historian than me, but this was the blow up of where we actually did it. It was Tucson South to Nogales, Arizona. So there's the beautiful Elephant Butte, and the Wi-Fi antenna went to the Longhorn Grill, connected us at the food bank and the Sapori School, which is the hub of the community. So by having this connectivity, we could not only to Tuba City and Nogales, we could, in a motto, deliver diabetes education to people at the food bank. How genius is that? Where they pick up their food, and the school. So there's the Longhorn Grill. There's the antenna they pop up on top of the mobile health program and the Motto Food Bank. So we would do screening for diabetes, but we also, more importantly, could do nutrition consultations. So by having that bandwidth on the left, rather than going into somebody's home and having, you know, a small group, a promotora, a local host with the family, we could go to the library and we could invite the whole family. And from St. Elizabeth's of Hungary, the diabetes educator could teach them. Now, if you're diagnosed with diabetes, you have to take that 6-week course. It's a we don't do anything every Tuesday night, right, for 6 weeks. So we put together a hybrid model, which was in-person plus video conferencing plus in-person potluck at the end. So people could take their diabetes classes, which includes being taught how to use a blood glucometer. So again, this is in the library. A family came, public health nurse was there, a promotor was there teaching them. The nutrition expert was in Tucson teaching them how to do their own blood glucose. And it was a lot of fun. You can see I got her Velcroed fruits and vegetables. She felt like she was juggling vegetables. But actually, it's a win-win for everybody because everyone in your family needs to learn about diabetes. And now, what does a diabetes educator want to do? They want to go into your home, right? But it was a very successful demonstration. And the other parts of this project included partnering with the Girl Scouts for a play that went to Nogales and Tuba, and they translated some of the terminology into their own language. We did screening for diabetes, and this is a really interesting business model, teleophthalmology, because the fact is, of course, the ophthalmologist wants you to walk in the office because they can do visual acuity and more. But my argument for the business model is, you know, we could bring them business they otherwise wouldn't have. If we can screen people in their hometown, and it can be somebody like me who takes 3 views per eye without dilating, and the same ophthalmologist can read them. So we put together the exact same patient medical history form they were using at the walk-in clinic, and referring sites send the ophthalmology images and get back the report. They don't have to store the images. It's business as usual. There shouldn't be anything cruel and unusual about this. So the primary care provider gets the results and says you need to travel for follow-up. And the thing that's also interesting is the software was very sophisticated and extravagant, but we didn't use the software. If we had started out trying to integrate and get software programs to interface and electronic medical records to be interoperable, we would not be a 25-year-old program. We wouldn't be here. So the software often we used sporadically just a way to send encrypted images. So one thing we learned about telepodiatry is primary care providers know enough about podiatry that if they give you a referral, chances are you have to have something done. So we used our grant money to teach rural clinicians how to do a better foot exam. Now, one of the biggest fruits of this labor was Diabetes Day. So once a year in Page and once a month down in Nogales, Mariposa, they schedule a Diabetes Day. Now, we really went and created a checklist. If you think about it, if you're a patient and you want your eyes screened, your feet screened, all of these things, this is about 5 or 6 appointments. Whereas if you block out a day and you assign rooms, specific things that you want to accomplish, you can get a lot done. And then if there's ever any downtime, we did education with a nutrition specialist in another room. Now, this is up in Tuba City doing a Diabetes Day in the screening, and you have to see this out of order sign. The first thing the public health nurses did was they put out of order signs on the candy machine. So to do screening, we could do screening, and then if people needed follow-up, we would go and we would put signs up on the kitchen. So the kitchen was where you could actually then connect back to that walk-in clinic in Tuba City. So your provider could sit there and say, well, you know, you need your medication refill. The public health nurse is going to be back next week. She'll bring it to you. You know, to be able to deliver services to people who need it the most efficiently, these are great pilots. And now this is all billable, all of these things. And we do have still a lot of work to do, and it is very difficult, but it's a beautiful part of our country, the whole Four Corners area, but it's also a very complicated part of our country. And you look at this chapter house map, there's different service units. There's, you know, 100 chapter houses, and some chapter houses have running water, some have electricity, some are very nice. But to be able to reach people there is so important because this is where people go to interact with their communities. And this is where people sign up to go and use the internet if there are computers available. So I think about the future of healthcare, and I think about trying to reach people where we can get them and get the most work done. And I think about Medicaid patients and access patients, and I think about being able to really improve access. And I think about the whole kiosk model. I think about the fact that we really do need to have public places where people can have private conversations about their healthcare, where they can take their blood glucometer and download their data and talk to a nutrition specialist, but not be broadcasting. Because you know what? There are people who, you go back to that map, there's people who are never going to have the internet in their home. I've accepted that. There are people who are never going to have the resources. They're never going to be able to sustain it, but they really need to have access, right? We agree. We've all agreed that people need to have access. So how do we do that in a cost-effective way? Now, it's a very difficult business model because all of these beautiful kiosks, they want to sell you the cloud above it, the provider that you meet with, and some beautiful ones have come and gone. You know, this was gorgeous, HealthSpot. They were only around for 2 years and went bankrupt. They had a nice little bench in the back because, of course, people bring their whole family for healthcare. So they really didn't get a lot of business because you had to buy into their whole system, their providers, their cloud, above it, everything. I just wanted the hut, right? But I think we could do something like this. I think that this is something that would be very viable for us as we look at building out access for folks in places like chapter houses, in places like libraries. And really, a chapter house is just another library, right? That's what they're used for. That's what people go there for. And I think that we have got the resources here in Arizona to do this. And I had to share with you this picture. This was the third floor of the library where Biomedical Communications had our office. And they were phone booths. And I had a bucket. I put together a bucket in my iPad. People used to come to my desk and ask if they could take their blood pressure. Now, it wasn't that I minded, but I thought, what a great idea. If people could, if they wanted to, just, you know, my fellow coworkers, well, if you want to take your blood pressure cuff, I put all this stuff in the phone booth. And what a great idea, because we do need to accommodate and make a plan for that. And coincidentally, Mala and I have been talking about this quite a bit. Next week, there are 2 webinars about this. People are going to be discussing their initiatives, both in Delaware and Indiana. We do want to watch these, and we do want to get together and have a discussion about, you know, what is it that we're going to learn, and do a review and talk about Arizona and talk about this in a way that, you know, we can really see what partners we need to bring in. The Arizona Department of Health Services has been partnering with our program to do the virtual office hours. Well, this would be a great hot topic. I'd love to schedule something the last week of August, and folks who want to participate would be more than welcome, because I would like to get together and review what we learn and see what we can think about moving forward. I also want to emphasize that, you know, we work very closely and have on any of the projects that I mentioned, especially the diabetes project, that was with ADHS. And as far as preparing the healthcare workforce in the future and involving our medical students in taking people's vitals and doing things in rural applications, you know, we work through our AHECs, the Area Health Education Centers, and they have just received funding to do a tribal AHEC. So I would also love to host them for a presentation in the near future, and I'll be sure that we all get invited. This is something else I want everybody to put on their calendar. The ATA has defined this week in September as Telehealth Awareness Week. What a great week just to get people involved, and I'll be sharing activities about that as well. So the rest of my presentation is all these great resources. We do have a grant funding page that's all about telehealth resources, but I got to tell you, I have a slide in my presentations now, and I send people to Local First Arizona because they maintain it, and it's everything. It's foundations that you've never thought about that have funding available. The other thing I wanted to share is we always have people ask, you know, who do you know that's doing teledermatology? Well, we have developed a service provider page in which we have vetted but not endorsed companies, but people who are providing services. So I can go and enter telegenetics in Arizona, and I'm at a federally qualified healthcare center, and 5 names will pop up of people who are doing that. If you want to find any teleservices, you can go to our website and find that. It's really a very good resource.
Janet,
we still provide, yeah?
I'm sorry to interrupt, but we need to wrap it up. We've got a couple of quick things to deal with. So
I'm so close. So we still do training, and please go to our website and find any of the training that you would like. It's free for healthcare providers and for folks who are interested. And then we do, of course, have all of that on our website. So let me stop there, because any of the events that you can go find, and I'll send you a PDF that we can distribute to folks that have all of those links. So you can click around and go where you would like. And I'd like to thank you so much for your time and let you know that I think that we do live in a very exciting time. And I think that it is great that we have the capability now, not just to extend broadband to people and help provide access to technology for people, but with those two things, we can also provide access to healthcare.
Awesome, Janet. You guys are doing incredible stuff and have been for years. So just a couple of quick things. First of all, can you clarify for people, you sort of touched on this, but the telemedicine program is actually not a health provider, but more of a resource to support people who are providing healthcare. Can you clarify that a little bit, please?
We started out as a pilot and demonstrative period where we purchased, just like we purchased FTEs from people like me and Rick McNeely and other team members, we paid a cardiologist, a rheumatologist, dermatologist to help develop patient medical history forms and a process for integrating those services and providing specialty care to rural sites. We no longer provide specialty care. We are no longer a healthcare provider, and the only clinic that we have is the one with our medical director for infectious disease. Another thing that still happens very sporadically, but is an incredible application, is we do have specialists that sometimes triage high-risk pregnancies from Yuma, because not only can the prenatal specialist define whether or not that person is a high-risk pregnancy, but whether or not they need to travel. But they also use that whole clinical encounter to help staff who's going to be on the helicopter, because you don't load up the whole family. You only get so many people on that helicopter ride, but it really is a fantastic way in which, again, they can very efficiently determine what to do with that patient and what level of expertise and who needs to be involved in the follow-up. So I hope that answers it.
So just quickly, again, we're pretty much out of time, but just quickly, Janet, just might want to mention that you kind of lead the Arizona Telemedicine BAT Broadband Action Team, and you might want to just mention that. And also, I believe you have a demo project that you're working with Jeff on. If you can take 2 minutes to talk about those things. I know it can take a lot longer, but we're kind of out of time.
Thank you so much for reminding me, because yes, I had a BAT slide coming up, but you know, Jeff has been working with the telehealth BAT and using that kind of BAT model that also has done great things in communities throughout Arizona, and other states have used that BAT model. So Broadband Action Team and the telehealth BAT has talked somewhat about this. I've had conversations with Mauricio. His passion, you know, is really doing this type of outreach and providing access in elder care. You really have to get together with the person that we met earlier. But you know, there's so many dots on the map, but there are people who are doing amazing things in telehealth, and there are things that we can work together to make happen in telehealth. And the BAT model, really, Jeff, you should speak of that. It's your brand.
We don't have much time to do that today, but we should talk some more about BAT and the grant that you guys are working on. So, Jan, one thing that's popped up in the chat is that people are saying, well, we should be doing this in the schools. So I think people have an interest in trying to figure out how to work with you to do that.
So just a couple of things I want to share real quick. We did do a school project as part of that diabetes grant. And one of the really smartest things we did was we sent the consent form home with the registration packet at the beginning of the year. Everybody in the school was consented for telemedicine. Now, we used a school where everybody was on school lunches. Well, those would have all been, we would have been able to treat them as access patients, and now it would be billable. So this really, I would love to follow up on this, and I really enjoy the comments in chat, and I do look forward to having that follow-up conversations, because I really think we can make it happen.
Okay, thank you, Janet. Great job. Everybody's just saying what a great job you did, so really appreciate it. So I just want to say one thing. Mark, did you want to add something quickly?
That was hands clapping, not a raised hand.
Okay, so I just want to say one thing, and we don't have time to discuss it today, but one thing that keeps popping up for me, and I think my conversation with Brendan the other day, is that, again, we have such great resources, and we've had a lot of new people who have joined us, and we need to find some way to continue to build the partnerships and relationships. And I know that a lot of folks after presentations and so forth, follow up with people, make connections, and that's really awesome. But I think that we need to perhaps think about more than that. So I just want to plant that seed and for us to think about how do we best continue to build the relationships and partnerships that this task force brings to the table.
And Steve, to that point, now that you're back from travels and holiday, we really need to refresh that working strategic subgroup that we had initiated to try to deal with exactly that, as you well stated.
Yep. Anything else, anything that anybody wants to share before we end for today?
Work Janet just presented is absolutely nothing shy of amazing. Janet, that is absolutely amazing. You guys are definitely moving the needle. And I think we need the big Zoom clap like Mark started for everybody. I mean, that's just awesome.
Yeah. Yeah. So people didn't realize just how phenomenal our telehealth program is here in Arizona. Pretty phenomenal. Okay, with that, thank you all.
Thank you.